All right, we will go ahead and get started here in just a minute. If you're here with us right now. Okay, I'll go ahead and get started here. So, if you're joining with us live, we really appreciate you being here. If you're watching the replay of this, that's okay. Just make sure not to miss our next one. So we are doing these Facebook Live seminars every Friday at 2 o'clock. So we started doing these about a month ago. So if this is the first one you've seen, make sure to go and check out our previous Facebook Lives. They're on our Facebook page. So we've done, back pain, we've done neck pain, knee, shoulder, and we'll continue to kind of do these as long as people are interested. We started doing these when all the virus stuff started going on, just to do our part to still reach out to people and hopefully help some people. We know that some of you out there are having some aches and pains, and we just want you to know that we are still here and we are ready to help. So we are the Physical Therapy and Balance Center, Ogden. We are inside the Ogden Athletic Club. My name is Josh Elzy, and Frank is joining me here. He will be monitoring the chat. So if you have any quick questions while you're watching this, go ahead and chat Frank there, and he'd be happy to respond to you there. And even if you're watching the replay or the playback of this, go ahead and leave us a comment, and we are kind of keeping an eye out for those. So if you have a question for us, let us know. So today we will be talking about foot and ankle pain and dysfunction. Okay. So to get started, we'll just kind of go over just some very basic anatomy. We don't want to get too detailed here. We don't want to bore you guys, but it is important just to kind of have a basic understanding. So first, we'll kind of talk about the bony anatomy here. So I think most people are probably familiar with like the two bones in your lower leg, right? You have your tibia and your fibula, okay? And then some of you might be familiar with the big heel bone. This is called your calcaneus. Okay, that's your heel bone. Then you have a bunch of other little tiny bones in your midfoot, and then you have a bunch more little long bones that run out and extend out to your toes. So all together, you have 26 bones in your foot. Okay, so there's kind of a lot of stuff going on in the foot. Okay, so next we'll talk about ligaments. So because there's so many little bones and things going on, there are a lot of ligaments required to kind of hold everything together. Okay, again, we're not going to get very detailed here. We don't want to bore you with all the names of all the teeny little ligaments. But just so you understand, there's a lot of things going on here. The two biggest areas where we see issues with ligaments are on the inside here and on the outside of the ankle because of usually because of ankle sprains. Okay, so when you sprain your ankle, that's when you kind of stretched out those ligaments, and that's kind of one of the most common things we see. So on the inside of your ankle, you have some really big, thick ligaments here. Okay, altogether they're called your deltoid ligament. Okay, those are the big ones on the inside of your ankle. And then you have fewer and smaller ligaments on the outside of your ankle. So that's why about 80 to 90% of all ankle sprains are when the ankle kind of, you roll your ankle, your foot rolls in. So that's why the majority of ankle sprains are lateral ankle sprains, or sprains on the outside of the ankle. We'll talk a little bit more about that here in just a minute. Okay, next up we have tendons. Okay, again, we're not going to get too detailed here because there's kind of a lot going on, but just just so you have a basic understanding, you've got a bunch of tendons that kind of run over the top of your foot. They run out and extend to your toes, and those tendons help to extend your toes or to raise your toes. You have a bunch of other tendons that kind of run on the back side of your leg and down under your arch out to the bottoms of your toes, and those tendons help flex your toes. So the big tendon that most people will probably have heard of or know about is the Achilles tendon. Okay, so that's the big tendon in the back of your heel, okay, the back of your foot. So your calf muscles, okay, they run into this big Achilles tendon, and it attaches on the back of your heel. Most people have probably heard of that one. And again, we're going to talk a little bit more about that in just a minute. Okay, so we are just going to kind of briefly talk about the most common problems we see with foot and ankle problems. Okay, so this list right here is probably the most common problems that we see here in our physical therapy clinic with the foot and the ankle. So we've got collapsed arches, okay, we've got bunions, Achilles tendonitis, plantar fasciitis, and like I talked about before, lateral ankle sprains. Okay, so let's dive just a little bit deeper into each one of those. Okay, so first up, so this is the collapsed arches, okay, or flat feet. So we call the physical therapists, the medical terminology for this, it's called hyperpronation. Okay, so when your arches collapse, that's called pronation. And one way that you can kind of tell to see if you have this problem is by looking at the back of your leg here. Okay, so if you take a picture of the back of your leg and you kind of look at, where your calf muscle comes down, that Achilles tendon that we talked about, where it comes down and attaches on the ankle, this right here, you can kind of see it kind of angles out right here. Okay, and that's a sign that the arch or the foot is collapsing. Okay, so this is what we call your rear foot angle, the angle that is made here in the back of your foot. And that's one way you can kind of tell. This picture right here is probably a really good example of what a totally collapsed arch would look like. So this guy has like zero arch. He has no arch going on at all here. And that can be, this can be a big problem. Your feet are what connect you to the ground, right? And so if you have problems at your feet, it's going to affect everything up the chain. So collapsed arches are kind of a big thing. That's something that we look for. So another way that we can kind of test, or one way that you could kind of self-assess if this is a problem that you have, is by kind of doing a squat and looking to see what happens at the knees. Okay, so if your arches are collapsing, a lot of times your knees will cave in when you squat. Now, there's a little bit of a caveat here. So this could collapse the knees during a squat, could also be a problem coming from the hip as well. Okay. But whenever we have knee problems, it's usually coming from either the foot and the ankle, and or the hips. Okay. But a lot of times if you've got, if you've got collapsed arches, you'll see your knees will kind of cave in a little bit like this whenever you're squatting. Okay, next up, we've got bunions. Okay, so the medical term for bunions is hallux valgus. Okay, your hallux, that's your big toe, and valgus just kind of describes how it angles in. So bunions is when the big toe gets kind of pulled in toward the smaller toes and forces that joint at the base of your big toe to kind of stick out like this. Okay, over time, this, you get a lot of rubbing here, you get a lot of irritation of that joint. You can get, calcification and kind of bone spurs, osteoarthritis here because of this. And that is what a bunion looks like. So the big culprit here is your footwear. Okay, so your shoes are super important, and we see a lot of these, the pointed shoes, high heels, and stuff like that. Those are the big culprits when it comes to developing issues like this. So more on shoes. Okay, this is super important. We're talking about the foot and the ankle. What you put on your feet is pretty important. Okay, so we'll kind of talk about different kinds of shoes here for just a second. So here we got those the barefoot shoes. I don't know if any of you guys have seen those, but kind of common in like the running population. Now, there's not necessarily anything wrong with these shoes, but um, the big problem is when somebody will go from just wearing their normal running shoe and they'll just jump right into these guys and they'll go run their 5K or, however their usual run. And that's a big mistake. Okay. So a lot of times here in physical therapy, we're seeing people because they get into something too, it's a too much, too fast type scenario. Okay. So our muscles and our cardiovascular system, they recover and they can adapt very quickly. But your tendons and your ligaments do not. Okay. So they take a lot longer to kind of condition to new exercises and new activities. So a lot of times we see you here in physical therapy because of an overuse injury or an overuse type of situation. Okay, so not necessarily bad, these shoes here, but if you're a runner and you want to get into barefoot running with these like barefoot shoes, you gotta work your way into it. Okay, it takes time. Okay, and you can't just jump right into running with these. Okay, another thing we want to talk about, some flip flops. Some of you out there really like these. They're probably not the worst thing if you're just going to the beach or something, but these are not great to be wearing around all the time. Okay, they do not give you any type of support. Okay, so this picture here shows your plantar fascia, and we'll talk about that a little bit more here in just a minute. But any type of shoe that just doesn't have any good support, that's not going to be good for wearing around all the time, and it's not going to be good long term. Okay, and back to these, the pointed shoes, the high heels. These are just really not good for you guys. These are just terrible. And I wish that the ladies didn't, want to wear these so much all the time, because they can just wreak havoc on your feet and your ankles. Okay, they just can wreak havoc on your joints and stuff. So you can see here, she's got her toes are all pointed, that can over time lead to the bunions and stuff. All of her weight is going through, the balls of her feet right here. Okay, so her metatarsals right here, all of the weight's going through there. Her toe is pointed, so her calf muscles are in a shortened position, and over time your calf muscles will get really tight, which can cause other problems. So high heels, guys, they're not the best, and we'd encourage you to avoid them. Here's another picture. We all know that you know, ballerina dancers and things like that are you know, these types of shoes and situations are infamous for having foot problems. So, you know, all their weight is going through their toes, and our feet were just not designed to take forces through them like that. Okay. So, anyway, off of my little soapbox there. Enough about that. But you guys know shoes are, your footwear is super important. All righty, let's talk a little bit about Achilles tendonitis. Okay, so I'm sure this is probably one you've heard of. So this is common in runners, in basketball players, jumpers, okay, running up and down hills, you know, your weekend warriors. So again, this kind of goes back to my comment before where I said your muscles and your cardiovascular system, they can recover and adapt pretty quickly, but your tendons and your ligaments, they take a lot longer to kind of recover and get conditioned and used to new exercise and activities. So when somebody picks up a new exercise or new activity, or if they don't give themselves enough time to rest and recover, you get problems like this. Okay, your tendons kind of get inflamed and angry, and Achilles tendonitis is a really common one. Okay, so a common thing that we see with Achilles tendonitis is tight calf muscles. Okay, so if your calf muscle is really tight, and then you go and try and run or play basketball or whatever, then that's going to be putting a lot of stress on that tendon. Okay. Okay, again, back to the high heel thing. We're just going to harp on this. So, when you wear high heels for a long time, okay, you can see her toes are pointed down, and her calf muscle is in a shortened position. Okay, and over time, you'll accumulate tightness in your calf, and then if that calf gets really tight, then you know, like I said, that's when it'll kind of pull on that tendon, and you'll run into this stuff. Okay, next up, plantar fasciitis. Here's a good picture of what a good foot arch looks like, and then another really good picture of what a totally collapsed arch looks like. Okay, this guy's got no arch at all. And our feet were designed like this so that they could distribute the forces of, you know, when we're walking, squatting, running. So that arch is designed to kind of distribute those forces through our feet. But if you don't have that arch, then you're going to get excessive forces in all the wrong places. And that's when you run into pain and problems. Okay, so here's a good picture of the plantar fascia, because the plantar fascia is just kind of like a big ligament. It's a big piece of connective tissue that starts on your heel and goes up to the pads of your toes here. So tight calves and, you know, pronation, collapsed arches, things like that, that will put this fascia or this connective tissue on stretch. Okay, and if it's repeatedly stretched, that's when it gets aggravated and irritated. Okay. Also, like we've talked about, we've harped on this, the poor footwear. If you're not supporting your arch with good shoes, then the plantar fascia again is going to get stretched out and it's going to get inflamed and angry. Okay. So when we look at plantar fasciitis, when somebody comes in with this issue, we commonly see tight calf muscles, and we also we want to take a big look at your big toe. Okay, so if you have lack of motion in your big toe, that's another common thing that is a root cause of plantar fasciitis. So here's a good picture here, just kind of showing a good arch, and then what happens when that arch is not supported or when it collapses. Alrighty, lateral ankle sprains. I think this is the last one. So like I said, you have kind of some really big ligaments on the inside of your ankle. And so it's not very common that you'll roll your foot outwards and get a sprain of the inside ligaments. It's much more common to have a lateral ankle sprain or a sprain on the outside of your ankle. And there's different grades of ankle sprains or ligament sprains. Okay, so a grade one. Oh, here's a good picture. So these are just this is just another picture again of the ligaments here on the outside of the ankle. And there's a bunch of different tests that we do as physical therapists when you come in and that help us to kind of determine which of these ligaments was maybe injured the most. Um, but anyway, so here is a picture of maybe what a grade one sprain would look like. Okay, so the mechanism of injury, you probably just tweaked your ankle just a little bit. Okay, grade one sprains aren't a huge deal. Um, Usually, you can walk on them afterwards, with minimal pain. You can kind of walk it off. You usually don't get, a whole bunch of swelling or bruising very much at all, if any. And these will usually, you'll get kind of back to normal within a few days or, a couple weeks or so. Now, a grade two ankle sprain, on the other hand, that's kind of, that's the more serious one. These are the most common ones that we see. Okay. With a grade two ankle sprain, you've stretched those ligaments out real good. You might have kind of had some micro tearing or partial tearing of those ligaments, and you will definitely have some swelling and visible bruising for sure. Okay, so this is what a grade two ankle sprain looks like. A grade three ankle sprain. Okay, so this is when you have a complete rupture of one or more of the ligaments in your ankle. Okay, you will have very significant swelling and bruising, as you can see here. And this is a scenario when you will likely need surgery. Okay. Um, Anytime after any type of an ankle sprain, whether it be a small one or a big one, it is very important that you work on balance and what we call proprioception. So when you sprain your ankle, you kind of lose some of that balance. You get some instability in the ankle. So it's really important that you kind of work on getting that back. You want to work on balance and proprioception. Because if not, it can turn into a chronic problem. Okay. Once you sprain your ankle, it's pretty common for you to do it again. Okay. It's kind of something that can reoccur. And especially so if you don't, do the right exercises and balance training activities to kind of strengthen that ankle afterwards. But like I was saying, with a grade three ankle sprain, if you've torn those ligaments, you're going to have some definite instability in the ankle, and you might need surgery um, because you're going to have some chronic instability in the ankle. And here is what we call a grade four ankle sprain. Just kidding. There's no such thing. This poor guy, Gordon Hayward, this is a compound fracture. So this is not an ankle sprain. This is a very serious emergency situation. Um, Poor guy. Glad he's doing better now. Okay, so that's kind of all we have for you today on the foot and ankle. If you have any questions, again, let Frank know in the chat. And if you're watching the playback of this, please leave us a comment and we will get back to you. So we just want you to know we are offering free 15-minute consult calls. Okay, so if you have any questions, please just give us a call. We are here to help. And if you have just any sort of little question, we'd be happy to answer it for you. And if you're wondering if you need physical therapy, we can let you know whether or not we can just give you some basic exercises and stretches over the phone, or if it would be better for you to come in and give us a visit. So that's our phone number there, 801-476-2000. If you don't want to come in, you have a question, also feel free to email us. Okay, here's Frank's email and my email here, and we're keeping an eye on those as well. If you have any questions that might, be a little bit longer, feel free to shoot us an email, and we'll get back to you. So if you like this, please give us a like, comment. So follow our Facebook page. Okay, we're Physical Therapy and Balance Ogden. Physical Therapy and Balance Centers Ogden. Ah, gosh, I've been talking too long. So yeah, give us a follow. And if you like these seminars, let us know. Like I said, we will be doing these every Friday at 2 o'clock. If you haven't seen our previous presentations, go back and take a look at those as well. We're also trying to post on Instagram at physical.therapy.oac. So give us a follow, give us a like. Hey, who wouldn't want these socks right there, man? That looks, those look comfy. That would definitely help with the bunions, right? So we all just want to let you guys know that we are doing telehealth. So we know that some of you may not be comfortable coming in because of the pandemic. So telehealth is definitely an option if your situation is a little bit kind of more involved and you need somebody to talk to. We can still provide you with very good information. We can still do a good physical evaluation and exam over the telehealth. And a lot of the insurances are now paying for that. So if you have any questions, give us a call and we can get you scheduled for that. Okay, we really appreciate you guys being with us here today. Let us know if you want us to keep doing these. And we hope that some of this information that we shared with you today serves you. So if you have any questions, please call us, shoot us an email, leave us a comment, and we will get back with you. Thanks, everybody.